All right, everyone, let's keep this rolling. I have the pleasure to introduce our next topic. It is called Intelligent Health, the Convergence of Data and AI. I was going to welcome to the stage, but they're already here, so I'm just going to do some brief introductions for the folks that are already on stage. But Vince Kuraitis, over here, Vince is the principal and founder of Better Health Technologies. He's an author, a speaker on healthcare strategy and business models, and he's also part of the faculty here at the Fast Future Executive on the future of healthcare. Here, Ramanathan Srikumar, goes by Sri, just in case you introduce yourself later. He is the Chief Solutions Officer at Emphasis. He's also a digital and cloud transformation leader and a member of the Forbes Technology Council. He's also part of the faculty at the Fast Future Executive on AI. Gentlemen, without further ado, please, the floor is yours.
Let me invite you to rewind the clock back to the year 2010. If you look at slide number 2, you'll see the headline, Radiological Imaging was anticipated to be a sector of rapid adoption in healthcare. Images such as X-rays, CT scans, MRIs, ultrasound, that's all the kinds of images that we're discussing here. And the image that you see here is actually one of a pancreatic cancer. So I'll pose the question, why? Why was medical imaging expected to be an area of early adoption? First of all, it was seen as very amenable to neural network analysis. The example that's often given to explain how neural networks work is you expose the AI algorithm to pictures of 10,000 cats and 10,000 dogs, and it will be able to discern the salient characteristics between cats and dogs. And when you show it picture number 20,001, it can tell you with high probability it's a cat or a dog. The simplistic thinking initially had been you show the algorithm 10,000 pictures of tumor and 10,000 pictures of not a tumor, and it will be able to discern the salient characteristics. The second reason why this was the case is that medical imaging data is among the most standardized data in healthcare. The DICOM standard for images has been around since the early 1990s. The workflow is also highly standardized in imaging, and imaging reporting is also highly standardized in medical imaging. So I'm going to read you a quote from Geoffrey Hinton. He is often referred to as the godfather of AI. He is a Turing Award winner, and he's a research scientist at Google. And here's what he had to say back in the year 2016. If you work as a radiologist, you are like the coyote that's already over the edge of the cliff but hasn't looked down yet. People should stop training radiologists now. It's just completely obvious that within 5 years, deep learning is going to do better than radiologists. To repeat from the godfather of AI, stop training radiologists now. In 5 years, deep learning is going to do better than radiologists. We'll come back to this a little later on in our discussion. Sri's going to give you some context on AI.
So that's kind of leads us to what AI is. And AI is not a new term. If people have been following it, it was first invented in the 1950s. So it's been 70 years since we've been talking about AI and the promise of AI. But what really turned things around was the introduction of ChatGPT. It was like the iPhone moment of AI, right? So suddenly everybody knew what AI is and everybody could access AI. Before that, AI was kind of this thing that only a few people, a data scientist who could actually go and do something with it. What really happened at that moment was AI was democratized. So any software developer or even us as non-software people could go and use the generative AI to tell you something, to find out something, to do some action for you, right? So that's really what has changed in the recent past. And that means that now AI is able to participate in almost every step of the process, of any process, and healthcare in particular. All the way from telling you what good habits are, how you can do, how to make you follow certain things that will help you in your good health. It can help diagnosis. It can help in medical inventions, drug creation, as Effie was talking about before. So it can intervene in almost every process of healthcare. And as Vince pointed out, a lot of this is actually requires good data. And without good data, AI can't make any progress, right? So as we go along in this journey, we will also see how there are some difficulties that we face with respect to healthcare data. Although it is there, healthcare is replete with data. I mean, there's so much of data. Every doctor makes notes. Every diagnosis is stored. Everything is stored, but still there are some difficulties that we face, and we'll talk about it in a bit.
Okay. So on the left side of slide number 4, you'll see the headline that healthcare is different. And in the book chapter, we describe 6 ways in which healthcare as a sector of the economy is not like other sectors. I've only got time to touch on a couple of these. But first, there's really disagreement across the world whether healthcare is a human right or it's a market good. In the US, it's looked at much more as a market good. And in most other developed countries, it's the opposite. It's looked at as a human right, and government guarantees high levels of health care. The second factor I'm going to touch on is that healthcare economic incentives are misaligned. It's often the case that you've got a physician making a recommendation for a procedure, a test, the patient receives it, and some third party, a government or perhaps a health plan, winds up paying for it. Healthcare is also complex, it's fragmented, it's highly regulated, and the culture is risk averse, and it just is not very on the edge of leading change. On the right side of slide number 4, you'll see 6 factors, despite the differences, 6 factors of common change across world healthcare systems. And again, I'm only going to touch on a couple of them. One is the payment mechanism, where traditionally healthcare has been paid for by a piecemeal system. It's referred to in the industry as fee for service. And the problem with that is that it incentivizes providers, healthcare providers, to do more regardless of the level of quality. There's no tie between what you do and the outcomes that a patient may receive. There's also a reference to data digitization, mispronouncing the word there, digitization, etc. And I will characterize this as a 30-year journey towards digitization, standardization, interoperability, and data sharing. It started in 2004, really when President Bush declared every American ought to have a medical record, an electronic record, by the year 2014. So we're about 2/3 of the way through this journey. We've got another decade to go. And back to you, Sri, to talk a little bit more about the uniqueness of healthcare data.
Yeah. I think as we talked about in the case of radiology, there's, everything is data, the images are stored. There is, of course, a lot of regulation around this in terms of HIPAA and others, that you cannot share this data. There is different standards, there is islands of data. The interoperability is not very clear. For example, you go to a hospital, your medical record is there. You go to another provider, and maybe that is not available to them, and you don't see that, right? So there's a lot of issues with respect to how you bring this data together and how do you make that work to enhance and to harness AI that we can really do. The other aspect, of course, is the fact that just having data is not sufficient. Like Vince was talking about, you need good data and you need representations of data that is existing as a healthy person and as an unhealthy person, right? So both those data is required. And most often, medical records only store data about people who are already sick and not really healthy. So that's one issue. The other issue is, of course, biases that creep into the data because the way we record or the way we treat people or way we test medicines and so on, right? For example, most of us wear these devices which measure your heart rate and measure your stuff, which collects a lot of information about yourself. But the way it collects is by using a green light that penetrates your skin and then measures your blood flow and so on, right? Now, obviously, that is influenced by the color of your skin, and the darker your skin is, the less the light penetrates, and that builds a bias in itself. So there are a lot of issues with respect to how data is accessed and how data is stored and can be analyzed. I'll move on to talking about a framework that we have used to kind of analyze or present the AI in healthcare or the influence of AI in healthcare. This is from a book called Power to Predict. This is a good framework for any general purpose technology, and we believe AI is a general purpose technology which can be applied across. To give you an example, when internet is a similar general purpose technology, when internet came, the first what we call point solution was what was SMTP, which was the mail transfer protocol, right? So there was one particular application that was developed, which was email, and you could go in and send your email to others, and others could receive it and read it. All it did was it made the delivery of mail faster and more instantaneous than it was before, right? That's an application solution that you see. Then that's a point solution. My terminology was wrong. When you talk about application solution, you talk about the invention of the browser. The browser came out in 1994 or thereabouts, and what that gave you is an ability to do many things on the internet, right? It gave a much more user-friendly way of interacting and getting more things done from the internet. So that is what I would call a system solution, right? An application solution. So that's an application which can be applied to many things. However, if you think about it today, how do you use internet? I mean, you use internet to call a car to your house or food to your house or anything that you want to buy, you can buy. Now that is what is a total transformation, right? So that what it does is it's a system solution which basically just changes the way you do things. It is not one particular intervention. It is not one particular point that you're solving. You're solving a whole range of things which transforms the way you do business. And I think all of AI adoption is going to go through these three stages. And most of what we do today is just point solution. So Vince, you want to take some example and talk about?
I will. So on slide number 7, we talk about intelligent health, and the headline is we're very early in the journey. In the book chapter, we give case studies, examples of all 3 of those points. And today I'm only going to cover number 1, but it loops back to where we started, the issue of imaging and AI and whether there would be early adoption. So recall the quote that I read you from the godfather of AI, where he said, "Stop training radiologists now," in 2016. Hinton was wrong, and he has since backpedaled quite a bit. So where are we in radiology, AI, imaging? First, there has been a lot of innovation and a lot of investment, over $6 billion worth of investment of AI in radiology and imaging. And in the innovation side, the Food and Drug Administration, the FDA, has authorized roughly 700 different AI algorithms. And over 75% of those are in the field of radiology and imaging. So there has been a tremendous amount of innovation, but as Sri alluded, all of this is point solutions, or almost all of this is point solutions. So what have we learned from all this? So medical imaging data, while we thought it was standardized, it's not as standardized as it ideally ought to be. Examples, different machines put out images differently, different storage systems. The data might be labeled differently as it's presented, and you touched on the point of bias. The second goes back to the economics, and for me, the most useful study that I had in college about what drives healthcare was Microeconomics 101. Just follow the money. And the simple truth is that if you are a hospital, a health system, or a doctor, you get paid the exact same amount today whether or not you use AI. So there's really no economic incentive. And in an ideal world, we'd like to think that improving quality would be a major motivator, but from one who has spent 35 years in healthcare, I'll tell you it doesn't sell very well. The third point in why relates to the plethora of point solutions. And ironically, the amount of investment that has been thrown at AI, it can't be absorbed by the health system. So if you are a doctor, a radiologist, or a hospital, and you have an option of picking from 500 different point solutions, all with different user interfaces and all with very specific contexts, there's no such thing as AI that can look at any image. They look at very specific images. They look at mammograms. They look at this thoracic cancer. They look at x-rays, chest x-rays. You can't absorb all that. And the average hospital, 50% of hospitals have not adopted any AI. And the punchline, the Moneyball punchline statistic that I'm going to read you is from the New England Journal of Medicine, 2023. Adoption of AI in radiology is at 2%. 2% adoption. So Hinton was totally wrong. The last slide, Sri, you want to introduce that?
Yeah. So of course, we've also given cases in the book which talks a little bit about how things have been shown, even point solutions have shown to be effective in some cases. And there's also studies on how acceptance is. Like, will you go to a doctor and accept an AI's position? Probably not, and we'll talk a little bit about that. So let me conclude with why we say AI is a general purpose technology, and I demonstrated. I give you an example of internet. Similarly, AI is something that can apply all the way from your diagnosis all the way to operations, right? Your payment collection, your payment processing, whatever it is. So there's a whole gamut of things that it can apply to. And the way, if you think about AI, what is AI? AI is, if you really come to the essence, maybe people who are in AI will not like this, but all it does is it predicts better, right? And if you look at any organization you keep standard operating procedure because you don't want people who are not qualified to predict and therefore do things. So you say, okay, if this comes, do this. Now, when you are able to democratize AI and spread it across, as some of the speakers earlier talked about how the way we work is changing, the way we work is going to change even in healthcare. So there's going to be systematic changes that are going to happen.
So to address the second point on the last slide, healthcare has lagged and we believe it will continue to lag. And the first applications are very likely to be much more on the administrative side. We are seeing a fair amount of adoption there. I've seen a lot of surveys, and clinicians and patients don't, for the most part, yet trust AI for anything that's clinical. And the hallucination issue really has gotten people's attention and understanding there. But to end our presentation and open up for questions that you may have, we are optimists. We think that in the long run, that AI will positively impact healthcare more than any other sector in our economy. And we thank you for your attention.
Thank you both. Excellent. So maybe to kick it off, I actually have a question for you two. I hope that's allowed.
Okay.
As I'm listening to you, Vince and Sri, it almost feels like we set unrealistic expectations for how quickly adoption of AI will occur, or the progression of it, right? Particularly in this case in healthcare. So maybe using radiology as an example, if that is an area where maybe we set unrealistic expectations and didn't necessarily meet those, I guess, number one, do you agree with that notion? And two, is there an area within medicine or across healthcare that maybe has met or close to or has exceeded expectations set by, the media, by our social networks, et cetera?
The area that is getting the most adoption, the closest to a killer app right now is, it goes by different terms, but I'll use the term ambient listening. It's a situation where the doctor and the patient are in the exam room and the AI is listening. And at the end of the visit, it presents the doctor with a summary of the visit. And the doctor, of course, has to look at that and edit it. Clinicians love this because it saves them time and it avoids what is typically looked at as drudge work, the clinical summarization part of it. I think their expectations were too high, and I guess I can't avoid pointing out, I'm starting to read headlines now that there's ChatGPT and similar multimodal language models are also in a bubble stage, that, all the things we've heard about these technologies. So, it won't be the first bubble we've seen. Sri?
Yeah, I'd just like to go back to the internet comparison. And if any of you have seen on YouTube, there is an interview by David Letterman and Bill Gates, and he's interviewing Bill Gates. And he says, what is this internet thing you're talking about? What can it do? And Bill Gates trying to explain to him, and he says, for example, there's a sports game, I can follow the sports game. And he says, I have radio for it. Why do I need it, right? So we are in that stage of AI, right? And if you look at it today, the kind of applications that internet has provided and the kind of business changes that it has introduced is what we think is going to happen to healthcare with AI as well.
Give it time.
Yeah, excellent. How much time was the question?
How much time is the question? Well, let me take a punt, okay? If you look at adoption in terms of the number of people adopting things, the radio took 75 years. The internet took 15 years. ChatGPT took 1 month to get to 1 million, okay, users using it. So in that sense, the rapidity with which this adoption is happening is quite high. And therefore, my prediction would be it'll be faster than what happened with internet.
Along those same lines, is it the clinician or is it the patient that is most skeptical? I mean, who is really holding this back?
The surveys done, which basically did both sides, and I think in the book we refer to one of those surveys, shows that most people are a little bit skeptical, but there are people who are accepting it. Like 30% of people are saying, okay, AI can still help me, right? Which is not bad at all. And the conclusion, I think, what we are trying to say is it's going to augment the clinician's work rather than directly supporting the end consumer. So it will be an augmentation tool for the professionals because, as I said, AI is good at predicting, but may not be that great at judgment. So that's where the human, if some better prediction tool is available to you, you can make a better judgment call, and therefore that's how it's going to help.
I want to augment something you're saying, Sri. I think the conventional wisdom within medicine and healthcare is today just the opposite of what Jeffrey Hinton said, that AI is going to augment, supplement, aid the clinician. No one sees in the near future that clinicians are going to be replaced.
Excellent. Well, thank you, gentlemen, both very much.
Thank you.